Palliative sedation is a word in a medical practice that's becoming more and more common, and therefore it's important that Catholics are informed about what it means in relation to Catholic teaching as to regard the end of life. Priests for Life Canada would like to offer the following reflections on palliative sedation. The Vatican's 1980 Declaration on Euthanasia doesn't mention palliative sedation, but it quotes from Pope Pius XII's 1957 statement endorsing the use of sufficient medication to control pain, even if there is a risk of unconsciousness or even hastening death. However, the declaration also added that the intention must be simply to relieve pain effectively. This is in keeping with Pius XII's teaching that such measures are appropriate when no other means exist, and that it should not prevent the carrying out of other religious and moral duties. He also warned that it is not right to deprive the dying person of consciousness without a serious reason. Palliative sedation can be defined in many ways, but broadly speaking, it means the use of medications to reduce consciousness. Palliative sedation does not always entail the complete loss of consciousness by the patient. Sedation may be deep or it may be light. The purpose of palliative sedation is to achieve comfort from refractory symptoms. These are symptoms that cannot be dealt with through other therapies. For instance, delirium is a common refractory symptom. And here are some important guidelines. 1. Palliative sedation must be considered a last resort. 2. The patient must continue to receive the full care that they need. 3. It must only be given for the pain control of the patient and not the pain control of the family, who may become emotional as they watch a loved one die. Fourthly, palliative sedation must always be at the lightest level possible. And lastly, the intention of palliative sedation must always be to control pain. Concretely, this last point means that the medication administered to sedate the patient should not be increased if the patient's pain is not increasing. While the dose may have to be increased as the patient becomes tolerant to the drug, palliation does not usually require a rapid increase in dosage. When carried out according to these guidelines, we believe that the palliative sedation which is commonly offered is compatible with Catholic teaching and is therefore a legitimate option for Catholics.